two co-presenters that are co-founders of SCC Consulting and leading a Golden Horseshoe Food and Farming Alliance with the University of Guelph research partnership involving a multitude of stakeholders studying local food procurement in a long-term care sector and affecting policy change. So two quick lines about them. Soni Craik Christie has 15 years of experience working with public agencies and institutions on reforming their food systems to better represent institutional values, to better serve clients and their residents, and to elevate the value of healthy and sustainable food through institutional procurement. And Stephanie Crocker has 15 years of experience in the charitable sector for the health and environmental causes, and led public agencies and non-for-profits to award-winning collaborations and initiatives that have reframed how sectors like health, education, and local food intersect. So please, I'll ask them to come live with their audios and visuals and get their PowerPoints up and running to lead us through a fascinating procurement exercise that helped to serve up local. So with that, please take it away.
Thanks so much for that introduction, Joanne. So yes, Soni and I form the consulting group SCC Consulting, and local to us is Ontario, Canada. We're coming to you from Southern Ontario, and we're so pleased to share with you today some practical advice to institutional buyers on procurement strategies that worked for our teams in long-term care food as part of the Serving Up Local projects in partnership with the Golden Horseshoe Food and Farming Alliance and University of Guelph. So we'll jump right into it here. In 2016 and 2019, under the Golden Horseshoe Food and Farming Project Serving Up Local, we worked with 9 municipally run long-term care homes in the Golden Horseshoe area of Southern Ontario. And by long-term care in Ontario, we're referring to living accommodations for people who require on-site care 24 hours a day, 7 days a week. Each home set a local food purchasing target of 5% increase from their baseline, and local food was defined as grown, raised, and processed in Ontario. This aligns with Foodland Ontario's definition. That's a branch of Ontario's Ministry of Agriculture, Food and Rural Affairs. After 18 months on the project, and despite the initial perceived barriers and concerns about meeting this 5%, the teams well surpassed their 5% goal with a combined average increase of 23% in local food purchases. Then in 2019 to 2021, this led us to a research project partnership between Golden Horseshoe Food and Farming Alliance and the University of Guelph to analyze the data trends before and after local food purchasing and tracking priority, to assist the Ontario Ministry of Agriculture, Food and Rural Affairs in making some evidence-based targets or aspirational goals under Ontario's Local Food Act. This is legislation enacted in 2013 to foster successful food economies in Ontario. So as was mentioned in one of the previous conversations, the data collection is so important to understand what's happening now and where we're going. So in terms of social and economic benefits, why we were doing this, public institutions have significant potential in supporting local economy and sustaining agriculture in Ontario. The annual average total food and beverage spend among the 15 homes that we worked with was $824,262. Extend that to all 626 long-term care homes in Ontario, and that's a rough average range of 516 million. That represents an incredible purchasing potential for long-term care homes to support local economies and public well-being through their food procurement. We believe that public institutions have that responsibility, as I know many others of you do here on the panel. Also, we believe it's an opportunity to build back better from the COVID-19 pandemic. Of course, there are environmental benefits to local food, especially if a product is grown and processed in Ontario, as per the definition we used for this project, but environmental impact was not a focus of this particular project. The fundamental drive behind this project was to address the long-term care food director's #1 concern, and that was to improve their residents' perception of the food offered. The social benefits of this goal are far-reaching. Worldwide, malnutrition affects 30 to 60% of older adults living in long-term care homes and greatly impacts health and well-being and quality of life. Canadian research by the Schlegel University of Waterloo demonstrated that poor food intake is considered the primary cause of long-term care malnutrition. The research identified key determinants that could contribute to increased food intake, a primary indicator being the residents' perception of the quality of their meals. We wanted to know more about what influenced the perception of food quality in long-term care environment. As part of the Serving Up Local project, our team administered a survey to 103 residents and their family members at 6 long-term care homes to determine if a local Ontario label increased their interest in and improved their perception of food served, thereby contributing to a positive mealtime experience for residents. And the results, 79% were interested to know if food was sourced locally, and 71% felt better about the food served when they knew it was sourced locally. Food is an important element of physical, emotional, and psychological health in all of us, but especially in this vulnerable population. If showcasing local foods to long-term care residents results in greater interest in food, then local food may be a tool to help address caloric consumption in long-term care homes and contribute to improved quality of life. So despite the primary goal of food directors to provide quality food and the very good things we saw happening in long-term care food purchasing, the calls for food reform in long-term care are wide-ranging. Research completed by the dietitians of Canada's Ontario Long-Term Care Action Group called for increasing fresh produce and quality proteins on long-term care menus. Then at the end of 2019, Ontario's Auditor General released a damning report on long-term care food and nutrition that identified specific categories of food needing to take more prominence on resident menus, and a call for performance targets and public reporting of the results. With only total food spend being reported by Ontario's long-term care homes, there's currently little opportunity to gauge the quality of food purchased and no ability to determine if all long-term care residents in Ontario are receiving the same opportunities in their meal offerings, let alone metrics to measure how effective a long-term care home is in meeting residents' food nutrition needs as per that Auditor General report. So this lack of transparency in food purchasing and unanswered calls for food reform has also resulted in declining public confidence in long-term care food, which has been further exacerbated after COVID-19 put a spotlight on long-term care.
But we do believe that change is possible. We can align our food systems with who we want to be as public institutions. We need to challenge the narrative that changing these systems is daunting. Our experience is that the dominant narrative in institutional food purchasing is that it feels limited. The food directors we work with often felt restricted by their food contracts. They didn't always feel heard by their distributors. Food contracts conversations can be laced with information about what can and can't be done within them, and contracts and rebates are often directed towards preferred vendors without conversations around understanding different possibilities or priorities. We find in conversations around changing institutional food purchasing priorities that there's an assumed lack of alignment with trade rules, lack of baseline creation, lack of tracking, lack of knowledge on food category spend, lack of knowledge on local products and vendors, lack of inspiration, and lack of time. And so it stays, as we know, with the status quo of acceptable food at acceptable prices. But in our experience with our long-term care project teams and through the data that we collected in this project, we see that when healthcare teams are informed about the various tools available to them to help understand and connect to their food purchases, and they're empowered by a better understanding of the leverage their food contracts have, food purchasing, food quality, and resident experience changed for the better. In the 15 years that Stephanie and I have been working with institutional clients on food system change, and through the Serving Up Local project portfolio, we've used some food procurement strategies that we wanted to share with you today to consider in changing public institutional food purchasing models. In the essence of time, we're going to skip most of this slide. The gist of it is public procurement directives and trade agreements all have non-discrimination clauses. And that means that within food contracts or RFP processes, there can be no weight or evaluation points given around the priority of food grown, raised, or manufactured in our province. And so this is where we find that most municipal and regional procurement offices stop. We can't prioritize it, and therefore RFPs are issued without any language that supports an institution or a municipality's goal around food purchasing or again, at acceptable food at acceptable prices in an environment of obscurity. So we can disrupt this cycle with good practices from the field. And one of the most important tools that any client can wield in the food system is a deep and robust knowledge about their food purchasing. And the way to get this knowledge is through detailed purchasing reports from distributors or group purchasing organizations. We've heard this before, and it's worth repeating. If we want to change the direction that we're going in, we first need to find out where we are. If you're going to pick a place to start in food system shift, start with your baseline. As Toby mentioned earlier, you have to know your baseline in order to make any targets around procurement. When we began working with our long-term care teams, 100% of them had never seen a velocity report. 100% of the teams did have no idea on how much money they spent on fresh produce, fresh proteins, texture-modified food, grocery items, desserts, beverages. And unless their spending triggered a review by the municipal accounting office, nobody asked for this information. As Steph mentioned earlier, there's currently no required reporting by any level of government for this kind of purchasing breakdown in long-term care. There is simply a report on whether the budget was spent or not. A velocity report is a purchasing report of all the food that's been procured in a given time period. Depending on who's creating your report, it might be divided up into categories of spend, and some distributors have even been funded by our provincial government to identify local products in their databases. But the important thing is to get this data, and then you can slice and dice it in so many different ways. The distributors and group purchasing organizations that were part of our long-term care's external partners were super generous with their time. And even though the creation of these velocity reports was not part of any agreement in their food contracts, they began submitting these quarterly reports for our teams. Why, you may ask? Well, simply because we asked them to. Any GPO or distributor has the ability to create these purchasing reports, but none of them will give them to you unless you ask for it. And we say, go one step further, include these requirements in your RFP and include the identification of total and local purchases so that you can understand your baseline. This inclusion does not trigger any non-discrimination clauses. It's within the boundaries of the trade agreements, and this data has the potential to change municipal and institutional food purchasing. Value adds are another piece of the RFP. They're the nice to haves, but they don't hold an evaluation weight. So again, this doesn't trigger any non-discrimination clause. As long as you're able to show proper competitive process with the evaluation components of the RFP, you can prioritize local food in the value adds. So we say right in things like regular reports on local food listings, include business performance reviews, monthly meetings with account managers and local food specialists, local food key performance indicators, time to work with the distributor staff on menu development. Healthcare organizations like hospitals and long-term care have big food budgets, and they're always going to be around. They're important clients, and they should ask for what they want. RFPs are the opportunity institutions have to define what they want their food systems to say about them. A few more procurement tools. Splitting contracts is one of them. Institutional food contracts in healthcare usually go through group purchasing organizations or GPOs. These group purchasing organizations are food contract negotiators that leverage aggregated purchasing volumes for better prices on food and goods. GPOs have different categories of food that institutions enter into a contract to purchase from. And when a category contract is entered, 80% of purchases are required to be done through that category's preferred vendors. However, there are categories that are commonly not contracted through GPOs. Two of those are fresh produce and fresh or frozen proteins. We see these contracts are usually awarded to the prime distributor, so the person who's bringing in the food already. It's easy, it's one invoice, it's one distributor, delivery logistics, and it's the easiest route forward. However, we encourage institutions to split these contracts off and source from smaller distributors and vendors for these categories. We found in our teams that fresh produce from smaller distributors is actually higher in quality and has more local seasonal availability. Furthermore, if the contracts are below the threshold of $25,000, then preference can be made towards local under the 2013 local food procurement policy by the province of Ontario. This is again where the knowledge of the value of the food category purchasing that you're doing is important, and getting those purchasing velocity reports come in super handy. We've also seen super great success in building relationships with vendors. One of the ways to do that is a food forward contract or a forward contract. This takes splitting categories and splitting contracts one step further as a procurement tool. A forward contract is a buying agreement that provides a purchaser with a guarantee that a specific product will be available at a certain price, while giving the producer a legal commitment that the product will be purchased at the set price for a set volume. Our colleague in Thunder Bay, Dan Munchaw, negotiates these with regional farmers for various commodities he purchases for his long-term care homes. He has forward contracts for Indigenous harvested local whitefish, lettuce, tomatoes, carrots, herbs. Dan's the procurement manager for Thunder Bay, and he uses the knowledge of his purchasing data to negotiate these forward food contracts. Food forward contracts can help to build the capacity of local farmers to supply institutional demand and provides institutions with a reliable source of local, sometimes regional food products. Dan tells us that the only time he receives complaints about food in his long-term care homes is when the growing season is done and the purchasing switches from regional producers back to the broadline distribution channels. And although we haven't had a chance to work on food forward contracts ourselves, we have been able to work with small to medium-sized enterprises on food product development for long-term care. We knew from our project strategy design phase that one of the priority categories our long-term care teams wanted to influence was center of the plate local high quality proteins. From past experience, we knew that VG Meats was a high quality beef and pork product supplier that had experience working with healthcare institutions and with group purchasing organizations. So we gathered up our long-term care teams, we paid for their replacements in the kitchens for the day, and we bussed them down to southwestern Ontario. And there we toured the VG Meats, multiple farms. We went through their production facilities and butchering facilities. And then we were invited for lunch at the family farmhouse. And this is where talks turned to business. The farmers were really keen to understand what kind of products our homes were using and at what volumes. And through the discussions on products and resident preferences, the group decided to work together to create a pork cottage roll. So this is a piece of pork shoulder that has been cured before cooking. It's an economical cut, so it's friendly to long-term care budgets, and it's highly popular with the residents in the homes. The farmers were able to take the information gleaned from our long-term care teams back to their product development teams. They worked on a recipe, and then they taste tested that with the long-term care residents. And the result was unanimous. And the VG Meats cottage roll replaced all of the imported cottage roll purchases on our homes. And we see the impact of those food purchases in the velocity reports. And the farmers feel the support of an institutional clients in their business. We've mentioned a few times in this presentation already the gap of tracking and reporting on food purchasing in long-term care homes that our research project has focused in on, because we feel that this is a really important gap to address. Just now, Stephanie will share some of the results of purchasing that we found once homes started to track and shift. But we want to also pair tracking with reporting. These two have to go hand in hand. Some of the municipalities that we work with contribute top-up funds to their long-term care food budget. And the expectation is that that money is going to go towards buying more fresh produce or higher quality proteins. But if no one's looking at the food purchasing, and there's no required reporting on food category spend, how do we know what that money is being spent on? How do we know that all the residents in our long-term care homes are getting equal access to fresh produce? How can we measure food quality increase or even create performance indicators around food purchasing, answering the call for food reform if we're not measuring and improving on what we're doing? Tracking and reporting helps keep municipalities accountable to the goals they have declared. If you can't measure it, you can't change it.
So how did we do this tracking? This project has the only granular food purchasing data from long-term care homes that has ever been analyzed publicly in this province. We worked alongside our long-term care teams and their distributors and GPOs to track food purchases over a 2-year period. So that gave us purchasing data before local food purchasing and tracking priority, and then after. We broke down the food purchases into 60 different categories. We took the analysis further and regrouped those 60 categories into 7 different broader food classes. And we were working with distributor and GPO lists that were varied. So all their categories were different, how they define local food were different. So that was quite an undertaking. We'll be doing a more extensive reveal of the results when we are back at Circular Economy Summit on November 16th. But here is a sneak peek. So what we found, that a local food mandate can help meet the nutritional goals that provide a social benefit in long-term care. We found that fresh produce increased by 19% across all participating homes, or an increase in spending of over 67,000. And local fresh produce increased by a combined average of 31%. Homes increased their frozen vegetable purchasing by 5% cumulatively, and local frozen vegetables increased by 34%. And it was a goal, as we've mentioned, of many of the long-term care teams to get local, fresh, and nutrient-dense proteins on their menus. So with a very limited increase on overall meat purchases between 2 to 5%, Ontario beef spend increased by 560%, Ontario poultry increased by 118%, and Ontario pork purchases increased by 469%. Many of the homes also increased scratch cooking and reduced their purchases of frozen entrees and other prepared foods, making a move towards less produce foods or processed foods. And in fact, 4 of the homes that we have interviewed as part of our final interviews have said that their scratch cooking was at 20% in 2016 at the beginning of the project, and they're now working towards 80% scratch cooking. That is incredible in the long-term care sector. And it's important to note that all of these changes to purchasing were carried out without any changes in the home's food budgets. There were no additional funds contributed to achieve these increases in local purchasing. And I see Joanne there. We're wrapping up with 2 more slides. The other significant thing was the ranges that we saw. So fresh produce range from 2 to 10%, and proteins range from 6% of the total budget spend to 20%. So if we come back to that fresh produce, what this range tells us is that residents' access to fresh produce in our long-term care homes is inconsistent. There's no suggested or mandated range of purchasing for this priority category of spend or exploration on the ease of access of fresh produce. This category of spend that has so much importance from a dietary public health standpoint, but also is what residents are asking for and contributes so much to the well-being of residents in long-term care, is concerning. An exploration of these discrepancies from home to home through tracking and reporting can bring transparency to long-term care food that many are calling for. So a series of recommendations will result from the Serving Up Local 2 research, one of which will be to recommend mandatory tracking and minimum food purchasing ranges to Ministry of Long-Term Care and Ontario Ministry of Agriculture, Food and Rural Affairs to assure the social benefits of food are being met. And these are the key takeaways that we wanted to leave you with in summary: that municipalities have a strong role to play in values-based procurement. Your big clients with the ability to ask for what you want. So do it, just ask for it. Use procurement documents and contracts to include velocity reporting and value adds, split food contracts for different categories. Engage directly with your vendors wherever you can for inspiration and for product development and forward contracting. And track food origin and food category totals. You'll be able to see the successes you're having in shifting the institutional food system and use them to report on government goals you may have, whether they be municipal, provincial, or federal, like climate declarations, economic development, and so on. And that concludes our presentation. We're happy to take your questions.
Soni, Stephanie, such critically important work, and especially now more than ever, as we know that long-term care facilities have come still struggling with the pandemic. Really interesting results, and so telling. I mean, there's no grayness around this. And one thing you've touched on that we didn't talk about during this whole summit was the sort of the responsibility, I guess, or maybe the opportunity for funding governments, irrespective of what level they're at, to require these social and environmental outcomes through their funding mechanisms, as well as, you know, direct purchasing. They have a duty of care, I think, and a responsibility and an opportunity that's maybe in the food example you're giving here, that they don't actually say this condition of funding is that you know, attain the same social and environmental benefits we're looking for. And really, it should be directly, and what I hear you say is directly tied to these reporting protocols that are completely absent, that would really be motivating or making us all accountable in the system. And obviously, the knockoff effects to local produce and local meats is just obvious. So much to work with there. And I'm so glad that you guys took on this project and you've come out with these results. We are way over time. So the good thing is we're having you back in our food session in November. So I know that delegates will want to hear the story again and maybe help them, you know, connect on what they can do as a result of conditions of procurement, for sure. So we're going to leave it at that.